Everybody ready? In Washington, politics is the currency of the realm. So it's not surprising that the Affordable Care Act, years after its passage, remains embroiled there in partisan considerations. But here in Kentucky, those of us who aren't under Washington's sway recognize the ACA for what it was intended to be, a tool to improve people's health, to help those who are vulnerable, and to remove lack of health coverage as the determining factor in a family's financial security. In Kentucky, we want to keep the focus where it belongs, on our people. That's why today we are marking a milestone that suggests just how important health care reform is to our families and our future. Let's turn this sign around. More than 413,000 people, actually 413,410 Kentuckians, now have health care coverage, many of these for the first time. Many of these for the first time, thanks to kynect, the state-based health benefit exchange through which we have implemented the Affordable Care Act. Folks, that's almost 10% of our Kentucky population. I'm joined by officials from the Cabinet for Health and Family Services, and more importantly, by some folks who will give personal testimony about what kynect has meant for them and their families. But first, let's talk about the 413,000, because several general characteristics about this group are important. Every single individual who signed up for health insurance through kynect had a driving reason to do so. Perhaps they had never had health insurance before and knew that they needed it. Or they wanted insurance but couldn't get it because of pre-existing conditions. Or they had been priced out of the private options available to them. It is estimated that 75% of these people who signed up via kynect previously did not have any health insurance at all. As a result, many of them were unable to access the care they needed to stay healthy. And many were teetering on the edge of bankruptcy if they weren't there already. Now let's break down this a little more, and let's turn this one around. Of this 413,000 number, 330,615 were able to get care when we expanded Medicaid to include more members of the so-called working poor. About 83,000 accessed insurance through the private market. Furthermore, more than half of all of these 413,000 kynect enrollees, about 52%, are young, under the age of 35. That's important for the long-term viability of the system because younger people tend to be healthier and have fewer health care costs. As for kynect itself, it's also worth noting that some 873,000 people have conducted preliminary screenings to see whether they're eligible for coverage and/or a subsidy or a discount. That is a lot of customer service. But quite honestly, that is not surprising because kynect has been hailed as a national model since its launch on October 1 for its continuous smooth operation and easy interface for users looking for affordable health coverage. Our IT people built a system that worked, and we have numerous people nicknamed kynectors who connect people with the coverage they need. These are professionals who know how to navigate the system, who understand the healthcare industry, and who care about the people that they serve. Many of our connectors are in this room right now, and I would like to give a round of applause to all of them and thank them for their work. Folks, literally thousands of people have been involved in making Kynect a success. And while there are way too many to mention by name, I have to acknowledge the leadership of Cabinet Secretary Audrey Tays Haynes and Carrie Banahan, Executive Director of the Office of Kentucky Health Benefit Exchange. From the beginning, I knew that Kynect would change the course of Kentucky's history by helping hundreds of thousands of Kentucky families, and I've never wavered in my support. But Audrey, Carrie, and their teams are the people who made it happen. So let's salute them. Now, we're not finished. The health insurance available through Kynect will enable us to make tangible progress in improving the health of Kentucky's population. Through the Kentucky Health Now initiative, which is being led by Lieutenant Governor Abramson, who is here with us. We announced that in February, and we are using the ACA and many other strategies to improve our performance in traditionally problematic areas like smoking, obesity, heart disease, cancer, and dental care. As for Kynect, the next open enrollment period begins November 15 of this year for coverage that will be effective January 1, 2015. We're going to keep enrolling people until everybody in Kentucky who needs health coverage has health coverage. Thank you. I want to ask Secretary Haynes to come up and say a few words.
Thank you, Governor. Well, obviously, I'm really pleased to be here today to celebrate the overwhelming success by all measures of our first open enrollment period. It was a little nerve-wracking at times, and we all held our breath. I remember on October 1 to be sure, even though the test had all been done, just holding our breath to make sure that it was smoother sailing for us than I know lots of people around the country had. And so it was a lot of luck, I'm sure, on our side, but I have to tell you, it was a lot of hard work of so many people within our cabinet and also, of course, at the exchange. 640,000 uninsured Kentuckians before open enrollment. All of us probably know someone who's been searching for health care coverage or maybe hasn't had it since high school or certainly since college. Someone with a pre-existing condition that made it, oftentimes health insurance was too expensive for them to purchase. Or we know someone who was working hard at a business that didn't offer coverage and who couldn't afford to purchase it for their family on their own. That's why I'm so proud to be here today with the governor and to work alongside him, his staff, and also mine. Without his vision and commitment to be bold, and this was bold, and take advantage of all the opportunities that was afforded to our state, long-term health for our state would likely not be possible. And when I'm talking about long-term health, the exchange, as we all know, gives people access to coverage, but it's the long-term health that we will continue to focus in on so our citizens become healthier. Access to health care is the first step, but turning around what has long been a health needle that never seems to move for Kentucky in the right direction is certainly our next big step. I want to extend also a very special thank you to Carrie Banahan. I've said this at other public events, but she was the perfect choice, and not just because we were successful. We knew all along that really there was no one else that had the background in Kentucky that Carrie brought to the table. She is a hard-driving manager, I confirmed with her staff this morning that they all still love her after all of this. She has worked both at the Department of Insurance, the Department of Medicaid Services. She was the head of our Office of Health Policy. Honestly, the perfect background. Knowledge of state government, but also knowledge of all the various systems and agencies involved. She and her staff have truly done an outstanding job and earned all the positive attention that they have received. Also, to our many vendors who've worked with us, such as Deloitte, Xerox, and Doe Anderson. Also, there are many others within the Cabinet for Health and Family Services who partnered with Carrie and her staff in this effort. And when I say partner, I don't mean that these people showed up at a meeting every now and then. It was a true partnership across the cabinet. And oftentimes people have asked us from out of state, how is it that you all were able to be possibly more successful than others? And we do believe that one of the secret sauces to this has been that we are all in one cabinet. And so we are naturally talking about the big picture as well as taking care of minute details together. And we sort of all rise and fall over there together. So I just want to shout out to the Department for Medicaid Services, the Department for Community-Based Services, the Department for Public Health, the Department for Behavioral Health, and of course all of my colleagues in the Secretary's office. This is a project that it truly has taken a village. And finally, a huge thank you to the advocacy community, our connectors and insurance agents who got out there and spread the word and helped to enroll over 400,000 Kentuckians. So this open enrollment has closed, but I have to tell you, we were already in a planning meeting this morning, and we are certainly looking forward to the next open enrollment period. Thank you.
I also might add that this number, 413,410, will change over the next few days because there are a significant number of paper applications that are being processed right now that are not included in that number. And so that number will continue to be revised as we include all of those that we've actually received by paper. I want to now call upon a couple of folks who would like to share their personal experience as Kentuckians with Connect and with the Affordable Care Act. First, Scott Ledyard. Scott is a small business owner in Northern Kentucky. Scott?
Thank you. Secretary Haynes, you'd mentioned October 1st, and at 5:30 on October 1st, I got out of bed, and by 6 o'clock, I was on kynect.org checking things out. And within a half hour, I'd found a policy that was a platinum plan that was going to end up saving me $230 a month. So I was interested and encouraged. So I waited till about 8:30, and I called my doctor's office and talked to the billing personnel and said, would you be able to work with me if I'm working with Kentucky Health Cooperative and kynect.org? And she said, never heard of them. But we had conversations over the next weeks and months, and I was able to get on board as of January 1st. And I was tickled to do that because since about 2007, when I started my business, I had been on my wife's policy. In the middle of 2013, it became obvious that that was not going to be an option, so I was an unwilling shopper for health insurance coverage and found out that generally it was limited and unremarkable and expensive. So when I heard about this, I thought, well, I'll kick the tires on this and just see what it's about. So I was glad to see that worked out. I know also during those prior years, I often talked with others to be welcome them to our organization to become independent contractors, to become small business owners. A lot of them were employees. And our meetings would be interesting, and they'd be excited, and then invariably they'd say, well, what do you have for health insurance coverage? And I'd say, well, you're kind of on your own. And usually those conversations would end soon thereafter. So I guess I kind of just look at this pragmatically, I think, in that if getting health insurance is a roadblock to starting up new businesses, then we ought to do whatever we can to get that roadblock out of the way. And I think Kynect has helped with that. So that's it.
We also have Beth Moore, and I think, Beth, are you from Louisville?
Yes, I am.
All right, come up.
Thank you. I am happy to be here as a Kynect success story today, although I definitely wasn't planning to be. I became self-employed in January and also signed up for health insurance through Kynect in January. And on March 11th, on a trip to Texas, I had to go to the emergency room and discovered that I was going to have my appendix taken out. I had the operation in Texas, and the whole time I was thinking, well, going to see how this works now. When I made it back to Louisville, unfortunately, I had apparently brought hospital-acquired pneumonia back home with me, so I wound up in the hospital again at U of L for another 3 days, which meant that as of right now, I've received over, or documentation for over $30,000 of medical claims, which if I had not had insurance would have been catastrophic for me, particularly having just started my own business as a self-employed behavior analyst. The wonderful thing was that the first documentation that I got, the first thing I had in the mail was a notice from my insurance company that they had approved the hospitalization in Texas, which was a little bit of a relief. And then so far, all that I've paid out of pocket is $150 out of that $30,000 bill. The insurance policy that I purchased, I was able to find a policy that I could continue to see the same doctors that I had seen through the U of L system. And that was what had helped me decide which policy I wanted. I was relieved that everything that I normally have to do was going to be covered, but it's also been a huge relief to really test it out. The folks in Texas were a little bit confused by what I was saying was my insurance, but it's worked very well, and I'm very grateful that I am a resident in Kentucky and that this was an option for me because it's made a big difference for me. Missing 3 weeks of work with no disability insurance. If I hadn't had health insurance, I'm not sure where I would be right now. So thank you all very much for your hard work.
Anybody have questions?
A couple of loose ends. Who's your insurer, Beth?
I purchased a policy on the exchange and my insurer is Humana.
Okay.
Did you have insurance before this?
I had been an employee of a nonprofit agency called the Home of the Innocents, which also uses Humana as their insurance. So I was actually able to continue all of my same doctors when I became self-employed.
But being self-employed, you didn't have any insurance.
I resigned my job as an employee. I do the same thing, but I'm now a contractor. So at the same time that I became self-employed in January, I went and signed up for insurance.
Because you can no longer be covered.
On your
Because
own.
I could, yes,
Right.
I
You're
would
not part
know,
of the
I
group.
would not have had insurance through an employer.
And what Scott, were you talking about the insurance for yourself or for your employees?
I am talking about insurance for myself as an independent contractor.
But what was your reference to people who, ended the conversation when you said you couldn't offer health insurance?
We're a collaborative of independent contractors, so kind of a group of nerds that help out with IT work. So, yeah.
So what's the name of your company or this
Or
group
your
of nerds?
association.
Thunderclap Technologies, LLC,
And that's based where?
Newport, Kentucky.
Governor, This week, U.S. Senator Mitch McConnell put out an editorial saying that this is gonna wreck the economy. And he's saying that, talking about, companies, their employees have to work at least 30 hours. A lot of companies will be cutting, slashing hours for employees, and this is all just gonna be a mess for the economy. What do you say to that stuff?
These critics continue apparently to sit in their own echo chambers and talk to each other. Because when you get out and talk to these 413,000 people, they are very thankful that we have moved forward both in expanding the Medicaid program and in setting up our own health benefits exchange to give folks access to these qualified health plans. This is working. Now, that's the bottom line. It's working. We started out with 640,000 uninsured Kentuckians. It's estimated that 75% of this 413,000 never had insurance before. So that's a little over 300,000 of those 640,000 that now have health care coverage. And is that going to make a difference next week or next year in terms of our statistics? It'll certainly make a difference in terms of their own health care. Beth's a good example of that. She would be facing financial bankruptcy with a $30,000 bill if she hadn't had this coverage. So immediately individuals see the benefit of it, but from a statewide health standpoint, it'll take probably several years to see a change in our rankings. But you will see a change in our rankings over the next generation because folks that can get health care coverage and can utilize preventive care and wellness initiatives as these plans are set up to do are going to make a big difference in the health of Kentuckians in general. And what that's going to mean is a healthier workforce for us. What that's going to mean is attracting more business to come in here because we'll have the kind of workforce that's on the job every day, as opposed to being homesick half the time.
What is the breakdown of the 413 between people who are newly eligible because of expanded Medicaid versus those who would have been eligible for Medicaid anyway, yet may have signed up because of the publicity?
The second category that you mentioned, the ones that are already eligible for Medicaid, are not included in that number.
You didn't include any woodwork in this? How many woodwork are there, do you think?
We don't know, and we won't know probably until June or July what the net woodwork number is.
But the woodwork number is
They're in there.
There are no renewal numbers.
there are no renewable numbers
Right.
in here.
But woodwork's in there.
So woodwork is in it?
Yes, it is.
Okay, all right.
So meaning that there are some people, I guess, what, is there an estimate at all? And of course, the follow-up question to this is that obviously the newly expanded category, the government, the U.S. government is matching 100%. And the ones who had already
Right.
would have been eligible are at the former rate, so it's 70-30. So
Mhm.
as a result, what kind of budget concerns are there with the people who may have rushed into the system because of the publicity around this policy?
You mean of the ones that are already eligible?
Already eligible.
All right.
But then signed up, and then presumably an extra strain on the budget because you're still having to pick up 30%.
Right. You know, we projected as best we could the woodwork effect as we went into this. The new group was projected and studied by PricewaterhouseCoopers in terms of what the cost would be to the Commonwealth over the next 8 years as the Affordable Care Act and the different matching rates are phased in. And PricewaterhouseCoopers told us that over the next 8 years, we would be creating about 17,000 new jobs because of the expansion, that we would be infusing over $15 billion in new money into our economy, which will ripple through businesses, make more money, and they will be paying more taxes. And that overall, this will end up from a budget standpoint as a plus over the next 8 years and not a minus.
What woodwork number did you project, and do you think it's gonna be above or below that projection?
We projected 17,000.
Do you think it's gonna be above or below?
We have no idea, but we feel good about it.
Governor, you talked about putting the people ahead of the politics here. But we all know that come November, the Republicans that are trying to take control of the State House have promised to use the Affordable Care Act in part of their campaigns. Given the numbers you've announced today, would you recommend for the Democrats that are running for the House to run on the success of Connect? Do you think that would be an effective strategy?
Certainly, every candidate's going to have to make their own decision about the issues they run on. But in general, the Affordable Care Act, come next November, is going to be looked at a lot differently than it was being looked at last November. Obviously, last November, there were tons of misinformation being put out by its critics, and nobody really understood it or knew how it was going to affect them. People are now realizing whether it will affect them, and if so, how. And come this coming November, the 80% of Americans and Kentuckians who the Affordable Care Act will not affect at all are going to know that it doesn't affect them. And so for them, it's not going to be a big issue, one way or the other. The 20% that are affected in the United States and in Kentucky, a lot of them, just like this 413,000 and more by the end of this year, are going to know how it affects them, and they like what they're getting. I mean, you've heard from Beth, you've heard from Scott, that they're getting affordable health coverage that they either were going to have to pay a lot more for or would not be able to afford in any other way. And so these folks are going to be very happy about it. So I would say to those who think they're going to make this the crowning issue and defeat somebody on it, have at it, because I don't think they're going to get to first base by next November.
Well, of course, the problem is that it has a convenient nickname of an unpopular president, actually. And, the word Obamacare is never used, the word federal never appears in here, ACA never appears in here. If you're going to get to this point where it's a positive, as you told the Washington Post back in January, when do we begin to see the tipping point where people begin to realize that it's not the harem-scarum that is being represented?
Well, whether you see a big change in the polling numbers when you use the phrase Obamacare or not, I don't think is going to be all that relevant come next November, because people out here in Kentucky are going to hear a lot about Connect and the Affordable Care Act and the success that we've had. And I think you are seeing in the polling now that when you talk about Connect and what is going on in Kentucky, people are very favorably disposed to it.
You were asked about people running for office, maybe not running away from this. Conversely, do you think it will hurt, for instance, Senator McConnell was mentioned, do you think it will hurt him because he has been such a fierce opponent of this?
Well, certainly there are 413,000 people now who have affordable health coverage that many of whom didn't have it before. And if Senator McConnell is saying he wants to take that away from them, then I'll let him explain to them what he's going to do for them instead.
You talked about the people, 80% of the people in Kentucky who aren't going to be affected. They're going to know that by November, so it's not going to matter to them. I know there was a survey that Senator McConnell referred to in that op-ed that Jack talked about, put out earlier this month by Morgan Stanley, that showed that the individual premiums have increased 29% in Kentucky in 2014, and it contributed that to the Affordable Care Act. I mean, do you think those people are going to be, they're being impacted by this?
You know, it has become popular to blame the rain on the Affordable Care Act, or the weather, blame the Affordable Care Act for bad weather, for car wrecks, for whatever may go wrong. The premiums, people's premiums for health insurance have been going up every year, I think since they've had health insurance. As a matter of fact, the health care costs have slowed down considerably over the last couple of years. Now, can I say that the Affordable Care Act caused all of that? No. The same as the opponents can't say that somebody's increase in premiums is caused by the Affordable Care Act. You're going to have some increase in premiums until we can get a handle on healthcare cost and slow that growth.
Couple more folks.
Yeah, Audrey, two quick questions. Of the 200,000 that Kentuckians now still are uninsured, do you know where they mainly are? Are they just spread across the state, or is there a section of the state? And I was wondering, will there be enough doctors to treat?
Well, first of all, Jack, to your first question, we don't know that there's 200,000 people that are still uninsured. We do not have the numbers of all the people that did not go on to Kynect but went directly to their health insurance company. So there are lots of people that would not qualify for any of the subsidies. So, and they were happy with their insurance policy, and so they renewed it, or they got a different one with the same company. And we do not have those numbers. We're hoping that we can get those at some point, but we don't know that there's 200,000 left uninsured.
So we just can't take, you had 600,000 before 413 shots. So that'd be wrong to.
I would say that the number left uninsured in our state is actually less than 200,000 at this point. And I think that's a pretty safe assumption, because we know from talking with the companies that many people have gone directly to them. And then to your second point regarding access, currently the cabinet is working very closely with the provider, the healthcare provider community, to look at all types of strategies for more accessibility. And if any of you have been sick in the evenings and have gone to one of the clinics at Kroger or at Walmart or someplace, we know that there are APRNs there. So there are all kinds of strategies like that that we are working with the provider community to open up. And now that the session is over, we'll get back to a real good focus on that, and continuing to work with them to look at other opportunities for healthcare delivery, especially focused on preventative care and keeping folks out of the emergency rooms.
Thank you.
Governor, we've heard from House Leader Simo growing used to the term Beshear care. Is that something that you embrace? Do you think that that's in any way to create distance in the minds of voters between President Obamacare?
You know, number one, I'm excited about what we've done and what we're doing. I'm excited because the people of Kentucky are going to be the beneficiaries of it. I'm excited because we're changing the course of our history by doing this. And I'm excited because I've got people like Secretary Haynes and Commissioner Banahan who have brought together a team of people to make this happen. You know, we've got some fantastic people in this state who have made this happen. And we're going to keep working at it until we find every one of those folks, however many they are, that are out there that need this. So, thanks.
Just one question is on the call for the session on the heroin bill or anything else. Is there any plan or consideration right now that you have on that?
Right now, we're continuing to go through the 19 different bills and legislation that were passed in the last couple of days of the session. And once we get through with that, we'll sit down and look at what business is yet to be finished. Obviously, you don't want to call a special session on a topic if you don't have agreement on what to do on that topic. And I agree, and I'm disappointed that we didn't do something, that the legislature didn't do something on the heroin problem that we're experiencing. But there are other pieces of unfinished business too, and if we end up getting to the point to where the House and Senate agree we ought to go into a special session, we probably will need to look and see what other subjects might be included, like Rupp Arena and some other issues that are left unfinished.
Thank you.
Thank you.